new act is passed, the union members would be required to return to work. 4 major pediatric hospitals in Ontario are sounding the alarm over a growing waiting list of children in need of surgery. They blame last month's surge of respiratory illness and a shortage of staff. Nearly 12,000 Ontario kids are currently awaiting surgery, half of them waiting longer than clinical recommendations. But as CTV's Avis Favreau reports, there is a whole group of healthcare workers who are ready to help but can't.
Among the 160 people attending this meeting are veteran emergency nurses, ICU nurses, PSWs, and other critical health care workers. Yet despite a dire staffing shortage across Ontario, none, not one, can get a job.
They say they were 66 short staff on the weekend. 66, and here we are readily available.
Despite working through the early pandemic, they were fired, most of them a year or more ago, for choosing not to get 2 COVID vaccines. Yet most provinces and territories, along with Ontario, dropped vaccine mandates a year ago.
They have served their purpose to protect us, and as any public health measure, they have to be removed in a timely manner.
But the Ontario Hospital Association continues to enforce vaccine mandates in its 140 hospitals, the only association in the country to do so.
What I find most hypocritical is that the facility that I was fired from is open to unvaccinated visitors to come in, unvaccinated family members. Why can I not go back to work unvaccinated?
There are no official numbers on how many healthcare workers were fired or quit because of the policy.
This is just a fraction of healthcare workers that have been laid off or fired due to not getting the vaccine. And I'm sure more would have joined us if they could.
The Ontario Hospital Association didn't respond to multiple requests for interviews from CTV, but in a directive to its membership, officials wrote, COVID-19 vaccination policies within Ontario hospitals should remain in place, given that they offer the highest level of protection for patients and health workers.
This isn't about patient safety. Patient safety is compromised when you don't have workers on the front line dealing with heart attacks, dealing with illnesses. It doesn't make sense.
Now the province says it will import nurses from elsewhere to fill the gap.
So to nurses, if you've been thinking of making Ontario your new home, now's the time.
Meanwhile, those terminated say they've struggled financially ever since.
We don't count. I can't collect unemployment. I can't collect welfare. And we're just left out in the cold.
Both the Ontario and Canadian Nurses Union also declined comment, as they are focusing on working conditions and wage caps, not vaccine mandates. John?
Avis, thanks for that report. Coming up, calling out the chaos from Sunwing.
Why'd you even let us rebook? Why would you even offer this service?
The complaints sky high while customer confidence nosedives. Plus, a 5th discovery that could spell trouble for U.S. President Joe Biden.
At Georgian College, we're here for you every step of the way, with services, systems, and tech to support you.
Open my GC life.
While always keeping it human. Well, most of the time. You choose when, where, and how you learn best, ensuring you build the skill you need. No matter what your goals, this is a place where you belong. Expect more. Get an education that works as hard as you do. Experience Georgian.
More out of life with the BMO Eclipse Visa Infinite card. Apply now and get up to 60,000 points.
I am yellow today. I shine my light out like the sun. I am blue today, calm as glass and cool like the sea.
Newfoundland and Labrador.
U.S. President Joe Biden is facing more scrutiny tonight after an FBI search of his Delaware home uncovered more classified documents. Authorities spent nearly 13 hours on Friday combing through Biden's home in Wilmington and taking possession